Your kids are soft. You lack discipline.
We landed on the moon!
You didn't earn the knowledge for yourselves, so you don't take any responsibility.
It's like we've forgotten who we are. Explorers, pioneers.
Welcome to the podcast, episode 50, talking about Dougies, high and tights, Dougies. What are some other, get your ears lowered? What other analogies we got?
All of your hairs.
All of your hairs.
Dropping down at race weight. all of them.
Yeah. So we, Seth and I went and got our hairs cut at the same place, and Alex was trying to figure out the logistics of why we went to the same place, and did we see the exact same person at the exact same time? It was a double hand haircut.
Saw me in the clinic yesterday.
She cut your hair here? Oh, see, I was confused. No.
Nope.
I thought that's the only reason she came.
She goes, I get a haircut on race week. Yep.
So
It's always like race week or a wedding. It always falls.
Is this
Because I go like once a month.
Is this on purpose, or are you like a show pony?
I don't know.
He
It
is.
just always falls once a month.
Okay.
he gets his tail trimmed.
Porcelain mane shampoo and curry combed. Yeah.
That's a good one.
All right. Well, yeah, I was going to try to make some segue from that into functional medicine.
Functional medicine.
Let's just make a hard right. So on today's podcast, I just want to talk briefly, not super in depth about any one functional medicine case, but we've talked about it a lot. We talked about it a little bit last podcast with the Lyme disease episode, which I haven't heard from the Lyme Disease Awareness Society yet about anything we said wrong. So, yeah, I got a thought there, but, so yeah, I wanted to talk about a little bit of functional medicine and how it's played into musculoskeletal cases in particular. But before we go into cases, I actually saw a post from a past patient's mom yesterday, because yesterday was
Peanut Day.
Well, there was something else.
Oh, it was. Yeah.
National Fluoroquinolone Victim Day. I'm pretty sure. Yeah. Well, there's a day for everything. So let me make sure I'm saying that right.
One day.
And we'll figure it out.
Mm.
So, Fluoroquinolone Toxicity Awareness Day was yesterday. So it does play into what we're about ready to talk about.
Yeah.
So this patient, won't say his name. You could probably find this out by researching what we're about ready to say, but that's okay. And they post on social media about its history, but was basically the Gatorade runner of the year his junior year. So was set to be a stud. Had already signed with the school to go run there, and was given, per his mom, went to basically an urgent care clinic after a race out of town, still in his like singlet and stuff, or in his running gear. And she was like making that a pertinent point here of like, the doctor knew he was a runner. There's a black box label on this thing. I didn't realize they had tried to sue like the doctor, and then the company that makes this drug is a generic drug. So you can't sue generic. That's another veil of coverage that we've allowed through the FDA here in good old United States. But anyways, he never ran in college, never ran again after that. So basically got knocked out. And I didn't realize he again, would he have gotten there, but like thought he was going to run in the Olympics one day, which I mean, not saying he couldn't. He was fast. Yeah. So brought that up. His kind of insight in the clinic was, I just remember him coming in to me and he's like, dude, I go out and run now and like my quads burn. I feel like I just can't run very fast. And I mean, I checked everything that we could musculoskeletally, and I'd never seen a case of this like in person. I was like, I don't know, man. And I think I tried a few things thinking maybe it could be like, extension based radicular stuff, almost like spondy based stuff, because it was like anterior thigh burning. And then I saw him the next visit. He's like, yeah, it's no different. I was like, you got to go, we got to go back to your pediatrician. Then the pediatrician referred him. They talked about that. He had done, I think, 2 rounds or maybe just 1 round. And then he ended up doing like IV therapy down in Mobile, like every 4 weeks for a couple months. Yeah. So that was one functional medicine case. If you guys have any to weigh in on here, but one that was just kind of interesting. I've seen a lot more babies as of late. It's just kind of something we do in here in terms of like, usually check-ins, like check in at about 2 days old, and then 6 weeks, 12 weeks, 6 months, 9 months, a year. And then, you should be fairly good to go, maybe 2 years. But this person was referred in just because their friend has been a patient of mine. And then they told them what we do, but then this person was like, oh, do you think they could help with like gas and stuff for a baby? She's like, I've heard chiropractic can help. And even my patient was like, I don't know if that's what they do, but you should still go see them. So she brings baby in, and honestly, the baby had a little bit. So the baby was just turned 2 months old, like the day before she came in here, and like neurologically, developmentally, pretty normal. Like still a side predilection, which we worked on a little bit because that should be going away. Troy was in there with me, and we saw that from a sagittal stabilization standpoint, a little bit behind, right? So it still looks like your 70-year-old man with stenosis, like diastasis and lateral protrusion and kind of, cleaving, which at that age should be going away, but it's not uncommon that it could still be there. So it's like right in the middle. So I even told the mom, I was like, I can't say this is correlated. The only thing that was kind of interesting from the musculoskeletal side is I had her breastfeed her, to calm her down, but also to be able to palpate her abdominal wall while she had just eaten to see if like anything, like transit and stuff is normal. But like we put her in this 3-month supine loaded because she kind of hangs out a little bit legs below what is normal. And you just basically like approximate her, spine to the table and kind of put her in 3-month supine. She just like calmed completely down from screaming. I was like, that's kind of interesting. I have no clue if that correlation or just whatever. But anyways, with her, I just, we directed everything to the mom. I was like, do you have any dietary, allergies, sensitivities or anything that you know of? And she goes, it might be slightly lactose intolerant, which would be one of the more common pass along things from breastfeeding to a baby where they could have digestive upset. But the interesting thing to me was on her paperwork before she even came in, I think I was telling Troy, I go, she has vitamin D drops that she's given to the baby. I'm like, why do we do that? I don't know. So then I went in there, and knowing that like one of the main side effects of vitamin D drops for kids can be gas. So I just asked her, why are you doing that? She goes, oh, our pediatrician said that since I'm breastfeeding, she needs to be on vitamin D drops. I was like, what? That's news to me. So we're basically a baby's drinking a fat and sugar concoction that's heavy in basically like sterile hormones like vitamin D, and it's a lot of fat. So then I asked mom, I go, do you take vitamin D? She goes, yeah. I go, well, baby should be okay here. So I go, that could be overkill. That could be causing it. And then it could be, maybe a food thing. Maybe it's not dairy, but I would eliminate that. So I go, let's take the vitamin D out for 3 days and just kind of see, because it should be fast. Like, because she was giving it to her in the morning. The baby's pattern was she would get more and more gassy as the day goes on. So that doesn't just seem like digestive issues. It seems like something you're eating. Like if I woke up and I'm like, I feel pretty good. And then like later in the day, I'm like, God, I'm kind of bloated and gassy. I'll be like, what am I eating at breakfast or lunch that's like upsetting my stomach? So it gets worse through the day. And then I was like, if after 3 or 4 days you don't see any change, then you need to remove dairy from your diet. Should be really fast to see symptoms removed from the baby, because it's not like you have to remove the like casein A1 protein from your system. It's just basically you're not conjugating that into your breast milk. So it should be fairly fast. So we'll see. So that was
So she is lactose intolerant, but she
didn't know. She just said, I might be slightly lactose intolerant because I get like maybe some upset stomach or indigestion stuff if I eat dairy. But it was a maybe, and it's not like I'm having diarrhea and bloating and gas and stuff if I eat dairy. So that's like a lot of people, I would say. Not uncommon. And then my question with that is that true lactose intolerance, or is it like other dietary stuff you've done your whole life and you can't, digest dairy very well, or the type of dairy you're eating, all that stuff? I don't know.
What are your thoughts on someone going to like an A2, like an A2 protein?
Yeah, I mean, I'm fine with that. I would say we still want to knock it out first, especially if you're trying to have a fast result, and then you can go back onto that. Because there's other things in dairy, we say casein A1. So A1 and A2 are the two different proteins. Supposedly older forms of milk before we started genetically modifying cows and feeding them grain and stuff had more A2, goat is A2, things like that. But there's other things that can bug people in there. So that's why I just like get rid of it for right now. Unless somebody's completely opposed to it. And then that's better than, something else.
This might be a broad question as well. Like I have a patient as well. Like I just don't know enough. I don't guess on like the breastfeeding side of stuff. So like she mentioned that her baby is lactose intolerant and also allergic to eggs.
And how old?
Just turned a year. And the pediatrician said that he could be growing out of that potentially, but like, I don't know, like enough on like why those two. Cause I feel like I've heard that a decent amount from like patients is their child is like allergic to eggs and
So
dairy.
there's certain foods that you're not supposed to introduce at an early age for a variety of reasons. They're either high histamine response foods, or the thought is, which I think is absolutely ridiculous because it's the opposite, that you'll build an allergy to it if you feed it to them too early because of like basically introducing these proteins, which is idiotic. I mean, what do we do for allergies with people that have allergies? Desensitization shots with lower levels of basically a protein is what causes a histamine response. So I think that's absolutely ridiculous. I think a lot of it is, what the person is doing. So the other thing is let's break this down for a sec. So when somebody comes in and they don't have a true allergy, so a true allergy is basically signaling from an immunoglobulin that like, hey, you don't have a proper response to this protein, versus a sensitivity is a conglomerate of your gut and like your immune response. It's not really an allergy. It's just like the way your body's operating. You don't handle this thing well, there's a ton of reasons. It's not just, I have a sensitivity to it. That's kind of like Sloan with gluten. She doesn't have a true allergy. She doesn't have, Crohn's or celiac or, crap her pants when she, eats gluten. She just has slight histamine responses, itchy legs, stuff like that she's been like, yeah, it's a 1-1. Like I eat that, I will have this. And then, you can be tested for it, which one of our mentors, Brett Winchester, brings up, like there's genetics that will predispose you to this. And then there's also testing for it. And if you have both, it's like, oh yeah, you for sure are basically celiac, right? And that's him. So then we go into all of these things of like eggs and, why are people more allergic to peanuts and eggs? It's probably exposure rates. So if you think of what's in our diet the most, right? And you're like, why are all these kids allergic to peanuts? It's what's in a peanut, how it's growing underground, aflatoxins that are associated with it. But the protein, I mean, we eat a ton of peanut butter. I mean, peanut stuff is used everywhere. Peanut oil. We eat eggs. Eggs are in everything. I mean, baked goods, so it's exposure. And then people's bodies aren't adept. So I don't think there's a lot of allergies. There's a ton of sensitivities that are run amok. True allergies, you're going to an anaphylactic shock. It's not my tummy's upset and I don't feel good. Yeah. And I think people, they just don't know the difference. They say, oh, I'm allergic. It's like, you carry your EpiPen around in case you eat an egg? No, because you're not allergic. And then you can not transfer if you have sensitivities, because again, what are you getting in breast milk? You're getting fat and sugar and a lot of immune response. Basically information is basically passing immune messages to the baby. So if I'm having a slight immune response, out of the 5 immune responses, one of them is an allergy, right? Then we have other ones that are going to be slightly into the sensitivity realm. It's like, yeah, that baby's going to pick that up too. So then that again goes back to the case we were talking about. Eliminate the things that bother you, whether it's you get bloated, gassy, skin issues, whatever, and just see if your baby does better. And then there's a whole other side of the parenting thing that you're supposed to give them this stuff early to literally like sensitize them to it. So it's like, I just think kids are supposed to eat like healthy food like adults and not crap. So it's like, do I want to sensitize them to Cheez-Its? Probably not. Like,
Yeah.
There's a bunch of crap in there that might bother them, but it's not, oh, let's get them used to that. It's like, peanuts. I mean, peanuts are a debatable one just because of how they're processed and things like that. It's not really nut. Yeah, that's a hard one. But eggs is a little bit different.
I did have I had a question on the vitamin D with the pediatrician. Was he assuming, you think that he was assuming because the mom is deficient in vitamin D? How is he making the correlation between that and the baby? Like,
so I asked, so I don't think I'll make sure. I don't think the pediatrician had asked the mom if she's taking vitamin D from when I asked the mom, because the mom was like, oh, do you think that's like, it's okay? That was never addressed. I didn't ask that point blank, but when I asked the mom, here, are you taking it? She goes, yeah. She goes, do you think that's enough? I feel like the pediatrician would have like answered that question for her. So I just think that's a question they didn't ask because they're treating the kid and not asking about the whole thing.
Yeah. This is a blanket.
She told me they told her because she's breastfeeding, they need to be on vitamin D. Like kids that are breastfeeding are vitamin D
always.
Deficient. That's how I took it. I will clear that up 100% to your questioning, and I was like, that's absolutely ridiculous. And maybe they're running on the assumption most people are vitamin D deficient. So then, A plus B equals C.
And if you knew she was, but didn't ask if she was,
that's no different to me than saying, oh, everybody needs vitamin D, because most people, how do you know?
Right.
If you don't and you take a bunch of it, I mean, there's bad effects of taking too much vitamin D. So it's like, it's not just, oh, everybody's deficient, take it. No, you might be. Might not be.
It's not like just taking a vitamin C pill and it being fine.
But even vitamin C, like, again, I've kind of, like, do we need to just be like smashing a bunch of vitamins all day? No. And people would say, oh, why, it's not bad. It's water soluble. It goes back to the B vitamin thing we talked about before. Oh, it's water soluble. You're going to get rid of that. Everything you eat is signaling something, right? And I think we don't think about it like that, that if I took 500 milligrams of vitamin C every day, that your body's getting a signal. And it's like, who's to say, and I'm not saying this is correct, who's to say that if you wanted that slight uptick in immune response by taking vitamin C, that you have like eliminated that response by just basically taking it every day. So then you go to take it when you're sick and your body's like, well,
don't have any. Yeah.
Cool. I do this all the time. Like, I'm not going to up ramp, cytochrome P activity or anything based on, and it's like, I have no clue if that's true. I just don't think if you don't need it, why are you taking single form supplements rather than being like, I like to try to get vitamin C from like, potatoes and oranges and stuff. They got other stuff in them.
Yeah. I think about it like, I mean, I was feeling a little sick a couple weeks ago and took zinc and vitamin C for like a few days. And then outside of that, I'm just going to eat stuff. Yeah. Whereas when we were talking about vitamin D with this case, I was like, well, we're going to do labs. I'm going to do labs at some point to see just generally what the rest of my health's looking like. But vitamin D would be one, because we were discussing how it's getting colder and it's getting darker outside. We've been busier in the office, for like more time in the office itself. And you may think like, well, you're not outside, you're not getting as much vitamin D, but there's definitely truth to that. So if I was to supplement it, how much, and is it even worth it if you're like right below a normal value versus.
And this is a bit woo woo, but even think about like high dose vitamin C that they've used in like cancer treatment and stuff. And is a conjunctive therapy like that or adjunctive therapy that has like been studied. We're not saying just do that alone, but if you're doing like chemo or something, but which is probably a lot of what the offset of what chemo and radiation are doing. You have a major antioxidant that you're pushing at 10,000 IUs or something. And it's like, oh yeah, that's going to help you. But no different than, imagine if you had to eat as much food as you needed to get like 500 milligrams of vitamin C if you felt sick. You'd be crushing so many like bell peppers and white potatoes and stuff. Which is like very, and the things that people think have vitamin C in it, like what's one of the highest foods? Like broccoli, right? Like, are you just going to go crush a whole head of broccoli, a bunch of bell peppers, be like, yeah, I'm good?
You will for sure.
You might. In that scenario, get your vitamin C, whatever, make sure it's a good source of vitamin C. Cool. Do that for a couple of days. You get that response and then come off of it, because again, like, I don't think you need to be running around like that all the time, in my opinion. But maybe I'm wrong. I don't know. So yeah, that was just an interesting case. We'll see what happens. I mean, I told her to basically wait a week and change and kind of see what the fallout is. Yeah, I just thought that was kind of interesting, because she's bringing that baby in thinking chiropractic. We've heard that, probably adjusting can help with like bowel movement stuff, which I'm not saying it can't, but like there was nothing with this baby that I'm like, oh, I was like, yeah, maybe we can correlate some of the stuff we're doing, in here with that, but I'd lean on that side much further.
What would you have seen musculoskeletal that would have told you, okay, this is probably more?
I mean, literally, babies. So this gets in, I know there's probably somebody out there that's going to listen and be like, oh, bullshit. But like, from using basic technique on like our kids, if they were constipated, it's like, well, why'd the kid get constipated in the first place? And is it a chronic thing, or I don't know, the mom ate something that would constipate her, and downstream effect, the baby's constipated, and you're like, well, you want to help them out. The mom's doing all the stuff we would do, right? Like stomach massage, basically moving the pelvis around. Because if you looked at a lot of like pediatric chiropractic, like it's not high thrust. It's, if we're going to say activator, snap them with a rubber band. I'm going to be honest, I hate the effing activator, like the stupidest thing in the world. And if you like it, you're an idiot. I hate it. I'm just saying that because the idea that snapping somebody is adjusting, is it doing something? It's giving you for an input. It is no different to me. And you're like, oh, it's specific. No, it's not. I could do this, and I guarantee you I'm getting the same response. You're getting a proprioceptive feedback through afferent input through your skin, which is no different than like me tapping you or poking you with a nail or something. That's what's happening. I guarantee it. And you can't, good luck, whatever.
But does your nail fix a PD?
A what? I don't even know what you're talking about. To be honest with you.
Someone did pay attention in try 4 and 5.
And I'm glad I didn't. Must have been reading a real book.
Loser.
Where are we going with that? Oh, it's like gentle adjusting, which is like holding a position, right? So it's like a static mobilization. Sounds like McKenzie. It's gentle mobilization, like moving them through a position that might be stiff, because babies can get like stiff in areas. In my opinion, a baby that is a loosey-goosey bag of jelly, motor control is going to trump like mobilization, like by far. So like this baby, like I showed Troy, like, hey, when she's just on her back, like she's kind of hanging out and like a little bit of not extension, but like not kind of sacrum to the ground. Legs are lower than we would expect. Cause again, a newborn, like if we just put a 6 week old baby on its back, what are the points of contact? If we like had that baby on a glass table, like what would we see as in terms of points of contact?
EOP.
So just like on their back, like what's touching the ground?
What age?
Like 6.
Blackjack Education. That's my little pet project with Dr. Audrey Lance out of Nashville, Tennessee. And we have 2 great courses coming up for you in 2026. So we're kicking off the new year right with DNS Golf right here in Birmingham, Alabama. 2 days at the farm, 1 day at Greystone Country Club. And we have Greg Rose coming in from TPI. We have Mark Blackburn, one of the best coaches in the world. We have Brett Winchester, the legend himself, and little old me will be helping teach a little bit as well. So you can go, again, blackjackeducation.com to check that out. Also, the last weekend in January 30th through February 1st, we have Dr. Richard Ohm coming to Nashville, Tennessee for DNSB. So if you're looking to up your DNS game in 2026, the best bet in clinical education, blackjackeducation.com.
Weeks old.
EOP.
Scapula.
No, I think it's just like whole like T-spine.
There's a big old flat pile.
Yeah.
Right? I mean, they should be. They're just flush. This baby is now hanging out like a little bit, like you can like slip your finger almost under lumbar spine. Not normal, not abnormal per se, because like she might be 3 days away from starting to like crank her. Yeah. Well, because when they, the angle of their legs, where their hands can kind of touch down their body, all these things matter. But like, she just might be in this little phase where it's going to connect. It's like, well, do you treat that or not? That's what I told the mom. Like, you can do this. You were kind of doing it already. I would just basically put her legs up in like 3-month supine and kind of approximate her ribs, do her pelvis, and just kind of let her be in this position, which could seemingly help function around here if you're not hanging on a bunch of tension. I just can't say like, yeah, that's causing your gas. I mean, that I can't say that. I'm sure somebody would. Yeah.
Maybe if none of the vitamin D stuff had been.
Yeah. If none of that works, I go, yeah, I'll work this stuff. Cause like I said, she had a side predilection that I think shouldn't still be there at that age. Besides that, it was just kind of that pattern of like, concavity around the lower abdominal wall and a little bit of like lateral protrusion and a little diastasis, which diastasis can persist up to 6 months, like normally. So I'm not worried about that. But again, I think it would be me telling a lie if I was like, hey, let's go home and do this, and then expecting the gas stuff to get better. Now, if they want to do that with it, cool. But I'm also like, let's try to figure it out instead of doing like 5 things at once. Yeah. So I'm curious, do you guys have any, whether it was just like, is ancillary to the case or anything that like sticks out maybe in the past, 3 months or so, where you're like, man, I had to really use a little bit of functional medicine stuff or have a conversation with somebody about something that did play a part in a maybe primary musculoskeletal thing, or somebody that came in, you're like, this isn't musculoskeletal at all.
Mine would be very short and simple. I feel like I think I've had 3 cases of young females that have had chronic headaches or migraines that seem to be doing everything to try to change it. And a couple of them were on multiple medications, of which all of them side effect was headaches. One even told me, she goes, before you say it, I know all my medications have a side effect of headaches. I said, okay. Granted, she had been having headaches longer than the medications, but all of them that I asked about their hydration, most of them weren't drinking enough. 2, none of them were doing any sort of electrolyte supplementation. And all the ones that started, their headaches got better. Like one of them had headaches for 8 years, and she's 17 or 16 or 17. And she was getting them almost every day of the week, and then started using elemental electrolytes and hasn't had one in like a week or 2. So I just feel like, I mean, we use it all the time and for training purposes, and we live in a hot state, so people understand, like, you sweat, you lose things. But even when it's not hot outside and you're somewhat active, like, you're losing that. And it's like when we're out running, if we don't supplement that and we get into a hole, it's hard to build it back up. Like, same thing can be had when you're not doing that at all, and then maybe you're not drinking enough or your diet doesn't look great. And people may not be super bought into changing a ton of things about their diet, but if you just supplement some water and it tastes a little better because they maybe don't like the taste of water, I found that's.
You didn't give them that unflavored element?
Sure.
Unflavored? Yeah.
Phew, yeah. Only did that once. I don't want to have it again. Oh yeah, it's just salt. Just straight salt.
Well, and then the other thing is, let's say somebody's drinking a decent amount of water, then you can have the whole conversation about the water system itself and like filtering out everything to the point where it's like there's nothing really in it that your body can like pull from or, help absorb. So like, does that mean you have to have 1,000 milligrams of element and like water? No, like pinch sea salt or something, which we talk about all the time. So yeah, it's drinking water, and that's like, it's still not going the way it should, like helping people absorb it, better sources, and then, up the chain if you're exercising and being active. Yeah.
Because I feel like a lot of times they expect there's a musculoskeletal component to it, which there can be. They can certainly have trigger points and suboccipitals that radiate to their forehead, but why not work on both? Because
also hydration status of like tissues. I mean, that's the other thing here. So like, yeah, it probably is concomitant of what are you actually changing, physiology, not just like from how your kidneys filter and things like that and hydration around your brain, but like the tissue tension and like sliding gliding surfaces, which again, I've got an air of like, I'm not the fascite, that's like, yeah, you got to have like perfect hydration all the time because you're whatever liquid crystal system, I don't know, whatever. Goes a little bit far, but yeah, I think it is important. If you're dehydrated, you can literally feel people's tissue. That's different.
Start leaving it on the table.
What about you, Seth? Got anything that sticks out or themes? I guess that was more a theme, even though it had some cases behind it.
Not really. Watch me have one a day. Mine would be probably on the same vein as the hydration. I mean, like, it's just something I just like easily talk about with my patients because they come in and most of them complain about having just either like cramps, like whenever they're doing some type of like exercise or if they're up walking around or they just like get to the end of the day and they're like, yeah, my legs just kind of like ache or cramp or it'll wake them up at night. I know there's a whole like other side of like labs you could look at with that, but most of the ones that have had that, I'm also dealing with some type of like tendon injury. They have, so it's just hydration of tissues. It's just like a stiff tendon and they're wanting to do this like big, like a golf. They want to do like a high, like a impact sport, like either like a jumper or something like that, but they're just not drinking water. I'm like, you're just putting a lot of like stress on like a very stiff tendon already that's supposed to stiffen when it needs to, but it doesn't have the like chemical properties to be able to handle that.
Yeah.
So it's like you start adding supplementation in, and I feel like I've seen just like the stuff that we do in here, the treatment and what they do outside of here is handled a little bit better. Just because it just sets them up for a better success in that area. That's I feel like it's pretty blanket, but I feel like a lot of my tendon injuries have been from people who just like are not hydrating very well.
Yeah. And we're pretty lucky that we're labeled a sports chiropractic business. So we don't get a lot of like grossly unhealthy people, right? Like we're not seeing like a ton of obese people with A1Cs through the roof. And we see a lot of people like that because it's just kind of more common than not. But like overall, fairly healthy people or young athletes, which, just because you look healthy doesn't mean you are, but like that's not something we're having to address quite as much, right? Even though we're in Alabama and, it is prevalent. But I mean, there's been people where, whether it's like just the adiposity itself, or you can tell they're not the healthiest person in the world and you get a couple visits in, the response isn't whiz bang. And whether you bring it up or not at that point of like, hey, I mean, most people know, but when you think like this response is terrible because of like what you're eating or you're crushing sweet tea all day or whatever. And like, hey, if you really want to get over this, and I mean, I've had to bring that up and I'm not like, hey, do a functional medicine visit with me and get labs. Like, I'm just like, your blood's 90% sweet tea. Like we know what we're going to find. Yeah. But I have also had way more people sign up for the like functional medicine program without us. We don't really market it. mean, a little bit, but not. And I think that's just because, again, like we said last time, it's getting more popular to talk about. I think people are curious about it. But again, like somebody that signed up yesterday, I don't know. They're a patient of mine. I don't think anything's going on other than like maybe they want to drop some weight or something. It's like a guy a little bit younger than me. So again, it might be hard. It's like that conversation might be a little bit hard because it's like somebody comes in here with back or headache and you're like, I think it's actually you're not just drinking water. This guy might come in for a functional medicine visit and I'm like, nothing's really wrong, right? On your labs, like pathologically, it's just you eat like a 5-year-old, like what, and that might be a hard conversation to have, but it's like, it's not supplements. It's not the specific plan. It's like, just eat better. Right. And that's hard because people are like, well, I want a plan. It's like, if I give you a plan, what do we know is going to happen? You're going to fall off of it when you can't like stick to it. And then you'll be back versus you trying to figure out a repeatable process that's like something you can do with your family, not just yourself. And yeah, we try to help guide them, but it's not like, hey, here's our farm diet to help you lose weight. Like that's, I think, not going to work long term.
That's the other one with going back to the hydration. Like I don't want anyone that's like listening just to be like, you got cramps, you have like hydration issues.
Oh, yeah.
Because the other one I see a lot of times is like, I get cramp, or I see people that have like cramping on someone who comes in with like a low back complaint or maybe like a hamstring complaint. And you just like, again, we talk about like approximating some hips. Like you put them in like a really good, like 3-month supine position, their back starts to like cramp and spasm just because it's like a new motor pattern that they haven't done before. And their body's just like not wanting to let go of that. Same thing on like a hamstring. Like I can't tell you how many times like you have somebody just like do like an easy little hamstring curl and it's just like, you have to put your hand like on like their like mid hamstring because they're fixing to like come off the table. They're cramping so hard.
Yeah. Like active facilitation, if you don't know like a new motor pattern, then also like fasciculating and cramping it, like fasciculating in particular with like stenotic cases, neurologic irritation, and then cramping at night in our, 50, 60, 70-year-olds, like a lot of that has nothing to do with hydration, but what's the thing that gets talked about now is magnesium. And then these people are always I think everybody asks, well, I'm taking magnesium and doing all this stuff and it doesn't change. And you're like, we're literally proving to yourself it's not a like electrolyte, like hydration thing. So we try to have the conversation. You see how your calf just looks like it's got like stuff rolling around, like that's your spinal cord basically getting like pinged around due to stenosis, which is good for them to know of like, oh, that's been going on for 2 years. It's like, yeah, I know you came in here last week. Stuff was going on way before. But yeah, like Seth said, multiple reasons. And even the research behind hydration and cramping, it's kind of showing it's right now, from what I've seen, split down the middle on like hydration electrolytes, but then like basically like neurologic confusion for the most part. So you run a motor pattern into the ground, your brain starts to try to create that same motor pattern, whether it's from like energy production or whatever. And that's the thing that's running out, which has nothing to do with electrolytes, right? And that's where you see these drinks like hot shots and stuff that's like cayenne pepper and mustard and stuff to basically give a neurologic like smack in the face. And it's like, ooh, I get rid of my cramps temporarily. But most of those people are just not training enough, right? So then they get into the throes of, 25 miles into a 50K and they're like, I always cramp when I hit that. And it's like, that might be hydration. That might be you're hitting your training limit and your body's like, I can't support that same motor pattern for that long. And like basically your nerve endings are just like, it's 0 or 100 because you can't titrate it anymore because it's like bombarded.
That's what I was about to say. It was like, I feel like whenever anybody tells me, like they're like, I feel like my hydration's on point and it's always at the same mile marker every time, and the course really hasn't changed. Like there's not just like this astronomical change in elevation compared to what they had already been doing before. It's like I don't think the eating is the problem. I think you're literally just running into like you cannot keep doing that thing anymore, right? Like no different than someone who comes in and like you have a runner who needs good hip extension, just have them do a glute bridge on the table and you'll see those suckers light up like a Christmas tree on their hamstrings. They have to come out of it and you're like, and then you expect to do this for 50 plus miles. It's kind of like you're not getting dehydrated on my table.
Mm-hmm.
Like you've been here 8 minutes,
which is a good point. And again, what if somebody came in, they're like, man, I always just hit the wall at mile 22 of a marathon. Like if they said that, you'd be like, oh, I think it's your training, right? Like if it was always, you're like, I don't think it's the weather that day. I don't think it's your hydration. We'd be like, oh, I think it's how you're training, but like we don't see cramps the same way. Now you can have it the other way. We had a patient that, at the end of our race last year, he's like, dude, I've been falling out of every race I've done. We got him wearing a sweat sensor and he didn't realize how he needed double the amount of fluids and then about a quarter more of the electrolytes. And he has like had zero to almost no issues since then. So you can have it both ways. And he's a bigger guy and just didn't know like sweat ratio stuff. So all that kind of leads back to what? Trying to figure out what's going on instead of just like throwing stuff against walls. Oh, I'm going to drink more water. I'm going to take more electrolytes. I'm going to do musculoskeletal treatment. I'm going to take vitamin C. It's like, well, you can test it, you know, and try to figure it out. But also sometimes you don't need to test stuff. So like testing somebody that needs to lose weight for a lab panel, I think is like lying to them. Like, what are we going to figure out on there? Like, oh, taking vitamin D and improving your cholesterol gets you to lose weight. No, you know how to lose weight, which could probably improve your cholesterol. And then like, you know, if you eat better food, your vitamin D might go up. Like instead of looking at it first, like we kind of know how we got here for most people. Now, if somebody comes in and they're, you know, 7% body fat, they're eating an immaculate diet and, you know, doing all the good stuff. And they're like, I'm having headaches every day and I'm waking up with low energy and stuff. They're like, that doesn't sound normal. Same reason that if somebody came in, they're like, man, I sit and my, you know, pain radiates down my leg. I'm like, that doesn't sound normal. Versus if somebody's like, my back hurts every time I do a squat and their squat looks abysmal. I'm like, well, I don't think that's an injury. It's probably how your squat. So it's just, again, most likely across the board. So yeah, that's, to me, I kind of like that it got to this point of like functional medicine seems extremely complex. I mean, listen to a podcast on it, go to a functional medicine practitioner that's going to just like word vomit, you know, every genetic predisposition and supplement and bio longevity thing. It's like, are the fundamentals in place? And if they're not, put those in place first. If they knock down dominoes, awesome. But the hard thing for that process for most people is what? It's patience. They don't want to wait that long. So they want to crush 10,000 IU's vitamin C. They want to go take, you know, Monjourno. They want to XYZ. And it's like, I can't blame them, but it's like, that's not going to last or it's going to have ramifications. So that's my takeaway.
And it's like, you also want it to be like as easily accessible for like patients to get out the door, which like, again, I have no problem with you doing, just going on like a 3-mile run or something like that. You're just like, yeah, I just wanted to pick up running. But at a certain point, it's kind of like, okay, well, let's just take a look at just like some general like sweat rates, labs. That way, like upfront costs, like maybe slightly up, but you don't have this back end cost of
running
injuries. And then you're not able to get out the door. And then you get this whole cycle of like, well, now I've got to rebuild the discipline to go back and start again, knowing that you also just got injured and they may have done this 2 or 3 times already.
It's the most common on the musculoskeletal side. Yep. Somebody gets into running and just, oh, I did pretty good. Wow, go crazy. And then you're like, and then we try to always say, well, yeah, there's probably a training up ramps there that didn't match, but also like, can your body withstand that from how you move and like how strong you are? And like 9 times out of 10, no. I mean, whether that's a 7th grader or a 70-year-old, and it's like, no. And that's hard for them. And they're like, well, I've been running. I was running fine. It's like, yeah, you hit a wall and you keep hitting that wall. Or, I mean, I think of a guy that I saw identical time last year, 3 weeks before the exact same marathon for almost an identical issue on the opposite side. When I asked him, hey, you been doing any of the, strength stuff we kind of talked about? The more I ran, the less I did. And he knew, right? Yeah. It's no different than somebody that's like, I eat cheeseburgers every day and I know I'm 30 pounds overweight. He knew. Then I asked, why aren't you doing it? He goes, I just, kind of time and everything. But literally with him and most people in here, we have the conversation as we exit care with like a runner. Hey, when you up your volume, you have to kind of go harder on the things that tend to come out, whether that's, hip instability or tightness someplace, whatever, because when you volume up, like your body's getting beat to hell or it's going to rely on old patterns. And I mean, perfect example, like absolute perfect. And I hate that he's hurting. I think it's going to be easy. I'll see him, I think, tomorrow. So hopefully it is. But we just don't think about it like that. And not that you should. I mean, nobody teaches you like, oh, you need to be able to move your ankle and your hip this way and stuff before you can run. It's just like, everybody's running. I can do it. So yeah. Same thing with, go back to functional medicine. Well, this guy eats like that and he looks okay and is healthy. It's like, yeah, you maybe don't realize he's exercising 30 more minutes than you each day, or his genetics are different than yours. So that does matter. And you have to do like, that's where it can matter when you get specific, but like, are you doing everything that they're doing first versus like, what? So, I mean, I've heard that a lot from like a lot of our female clientele in the gym of like, I'm doing all the same stuff I was and I'm like not able to lose weight. Yeah. It's like, well, you're a different person, right? But are you as healthy as you could be Or are you a different person that's doing the same stuff you were 5 years ago? So you're like, yeah, I drink a couple times a week and I eat 80% healthy. It's like different person. So those same things may not work with this person. So you might have to get more healthy rather than thinking, what pill do I take? What drug do I take? What do I do? And I know I'm not beating anybody up that's doing that stuff, but like that stuff has a shelf life. If we're talking like, GLP-1 or whatever, it's got side effects. You know, it doesn't usually have side effects, healthy food. So yeah, usually, I mean, you can get Giardia from anything.
Be on the look on the social media because we're going to have a post here soon. We were just talking about it. That probably one of the biggest things that irks me when it comes to runners is like not enough load when it comes to the strength training and in the actual session, not enough weight. Thinking that it's somehow going to hinder the running. And yes, as you get into more running, you said, for him, it might have been time.
Mm-hmm.
It takes longer to go run 10, 12 miles than it does to lift weights. Now, do you have to have the amount of mileage that you're assuming you need to have for the race?
That's the problem.
And that's probably, one of the biggest, because that's the controllable variable. But to get faster, you run more miles. Maybe. That's different we've talked about it before about the pro runners, how that is really a good indicator for them, but not necessarily for everybody else. And I feel like even just building up to the longer races that I'm doing, I'm not running a crazy amount, 30 to 40 miles a week total. Now we'll see what happens on race day, but able to strength train 2 to 3 days a week. I feel pretty strong when we go out on some of those longer runs and hit hills and going down hills, which like that's a big one. I feel like
nobody thinks about, I should say nobody. Most people, that are doing their own programming or following an online training plan or even with a coach, they don't think about workload versus just volume. So what I mean by that is, like you the other day when we were working out, you went and ran 3 miles, then you worked out.
Yeah.
The workload there is bigger, right? You could equate this somehow from energy expenditure, but if we looked at like, okay, somebody's going to go run 6 miles, but Alex went out and ran 3 miles and then did a 45-minute to an hour weight training session, the workload's probably higher from you. Now, yeah, you have to do certain types of workouts for running and stuff. And I know it's kind of taking a running turn here, but what we don't think is somebody says what? Well, my plan says I have to go out and do this pace run for this. And then they think, well, if I lift weights either before or the day before, I'm not going to be able to hit that pace.
Sure.
That's the problem. And versus thinking, well, no, program weight training, reduce the pace, the workload's the same, and you're actually better for it because mechanical efficiency goes up, power output, maybe even neurologic like output while you're running based on how you program your workouts into it. Nobody thinks about that. It's just like, hey, we're going to lift weights. And then it's like poorly planned maybe around it. You get to the Olympic level and stuff. Sure. People are that aware and recovery times and, decreased force production during like a big strength phase and like where you put those in, like that stuff matters. But for the lay person, there's like, oh, I'm not going to be able to do my run at that pace, that distance because of this versus, well, how do you change the run with the weight to get the same exposure? And that's hard. I get that. Cause like, well, how would I do that? First, you could just start by the same thing. If you're going to eat more healthy food, you could be like, well, I'm just going to run a little bit slower and do the same amount of miles and still lift weights. Or I'm going to run a little bit less miles at the same pace and lift a little bit of weights.
Yeah.
Like I guarantee you for 90% of people, because there are a subgroup of people that like volume, they can just crush it and it will help them. They'll run faster. But I would also want to look at the injury rates of those people that perform well, right? With this, we have volume runners and neuromechanical runners, aerobic runners, how they do long-term with injuries if they're not doing, general movement strategy, strength training stuff for somebody that is, regardless of how they respond to aerobic training.
Because the other thing is like, your body doesn't know pace and knows like stress.
Mm-hmm. Yeah.
Right. So like the stress you put on it, right? You have outside life factors on top of also like, hey, did you do a hillier run versus like a flatter run? Like paces is going to look a little bit different, but this hilly run may actually been a lot harder on you, but it might have been a minute per mile slower than this. Mm-hmm. And it's like, when I go out and run, like everybody in this room right here might have a different feel of what 10-minute pace feels like. Right. And like, you can't just be like, hey, you're 100% like a 10-minute mile a 10-minute mile guy. It's like, well, that might hit you less than it hits one of us. Right. Or vice versa. And it's just like that. You got to be able to recover from that. Like, it's not going to be like, oh, my body doesn't wake up and it's like, yep, 7-minute pace is today what I have to do.
Yeah. And it's also a day, like, if you go work 12 hours, like, should you still go do the same programmed run versus like, I don't know. I think like,
this episode of the Farmcast is brought to you by Rock Tape. Use code FARM20 for 20% off their core courses at rocktape.com. It includes everything from kinesiology taping to vibration and mobility training. We use Rock Tape here in the clinic. We use all their tools. We've done all the training. It's all worth its weight in gold. So again, use FARM20 at rocktape.com for 20% off.
And that's tough. I mean, it does get tough. It's like I went and did that run the other day after eating, pasta and stuff the night before. I was like, I felt sluggish. And it's like, could I have pushed through that? Yeah, it was just, I'm not like training for the Olympics. So it's like, oh, I'm just going to run the pace, but I definitely felt off. And then I think it's very popular now to be like, regardless of how much you slept or feel or whatever, just like hit your goal, run more, maybe like, yeah, not everybody's true at Hanes.
Yeah,
so,
we could see a benefit if the running community embraces the new wave of the hybrid athlete, because they'll be like, oh, this is what weight training should look like.
Yeah.
But we also could see that where I'll just do more.
Yeah.
I'll just keep doing my miles and I'll add that on and I'm just going to be fine.
Also, if you look
less sleep,
if you look,
less sleep, smoking a skig.
I saw True Haynes put a post up that he got back from, I don't know, Norway or Iceland, somewhere where he was. And he goes, I'm going to go out and run before he went to bed. Like, he'd been out for like a day and a half. It's like, also realize that is a different guy than you.
Oh, yeah.
Whoever's looking at that post for the most part. Like, he is
Hopefully
trained for a long time. Yeah. And just be like, oh, his ability to absorb that stuff in the face of like sleep deprivation or whatever is probably a lot better because of his physiologic like setup before versus like, I kind of just smash some beers and eat cheeseburgers and I think I'm jet lagged. I'm gonna go crush 10 miles. Like, you might blow your knee out. Like, I don't
get some pretty good epigenetics too from old pops.
Yeah. Well, hey, we finished it on a functional medicine. We said epigenetics. So we took a running detour there.
Ran and came
back up. Yeah. Somehow on the runway. Anything else on that before we jump off here? No.
Nah.
Cool. And then I do have a podcast coming out because this will come out next week. This is what, 23rd or something, where I go over Sloane's genetics labs and we go over her whole functional medicine plan. But if you listen to that episode, realize I go through all the high level stuff and watch how fundamental we come out with. Well, what are you going to do? What are you going to take home from this? And we reiterate that of like, it's not 20. I mean, you look at the AI generated plan, the 3x4 genetics plan of what she's supposed to do. I mean, she would literally just be doing wellness stuff all day, taking supplements all day, probably not even able to eat. She's taking so many supplements. Like, this is ridiculous. So like, getting those tests are great. The pumped out plan of like, well, just do all this stuff, virtually impossible and probably not beneficial, to be honest with you either. Just too much. So look for that coming forward. See ya. Thank you for tuning in. Please subscribe via YouTube, Apple Podcasts, or Spotify. If you like the message, please share it. We appreciate it. Thank you.